Good evening, ladies and gentlemen. Today we will discuss a few areas of compliance which are very important for a healthcare institution. My name is Maribel Rodriguez, and if anyone has any questions, please make a note so we can address them at the end of the presentation. There are many areas a healthcare institution must follow compliance with. However, during this presentation, we will review the importance of the Code of Ethics, resource allocation, and cultural competency. Moral right. To begin, I will ask you, what is moral rights? Well, moral right can be influenced greatly by many factors such as religion, ethnicity, cultural, social, and even childhood experiences, but this is at an individual level. It is the good or bad, or the right and wrong standpoint. However, healthcare moral rights can be described as acting accordingly to the rules, policies, and regulations established by the law to ensure business transparency while protecting the stakeholders. The importance of compliance in the healthcare industry is to prevent, detect, and eliminate illegal and unethical practices which would result in violations of the established laws. The Code of Ethics in a healthcare setting is not limited to the doctors and nurses. All healthcare institutions must establish a set of principles to include ethical and unethical obligations. All staff members, from the board of directors to the housekeeping employees, must honor these: trust, dignity, respect, honesty, integrity, fairness, caring, and accountability. Resource allocation is not an easy task in a healthcare setting. Why? The demand surpasses the available resources. The priority is to keep the facility and staff in compliance with the state and federal guidelines to be able to operate. Then the healthcare administrator must evaluate and determine which of these patients will be receiving medical treatment, who will need to wait to receive treatment, who will need to seek treatment elsewhere, and who will unfortunately be denied treatment due to excessive resources. Healthcare institutions must demonstrate compliance with healthcare moral right. Healthcare institutions cannot give any preference to any social or cultural group. Resource allocation should be determined by the utility or the greatest good rule, efficiency, and fairness. Under cultural competency, compliance of law regulations related to the cultural diversity in the healthcare industry is very important to provide patient services free of discrimination regardless of their race, ethnicity, gender, sexual orientation, religion, and even their language ability. To reduce liability, healthcare organizations must follow compliance with laws or government entities such as the federal law of the Title VI of the Civil Rights Act of 1964 in class, the state legislation, healthcare accreditation bodies, and also the American Society of Healthcare Risk Management, among many others. The goal of these is to address the patient's needs regardless of their cultural background. In conclusion, the healthcare industry is very complex. If healthcare institutions want to continue operating, it is necessary to implement compliance guidelines based on elevated ethical and moral standards. Those institutions who can achieve to implement and maintain compliance with federal, state, and other healthcare entities will be able to piece together each element to operate successfully. Thank you.